Hi guys, this is Abby Harrington, and we're kicking off the first week of online classes with a couple of clinical presentations. So mine is on epithelial ovarian cancer. So just to kind of break that down for you guys, ovarian cancer is any type of cancer that arises from ovary cells, but there's actually three different types. So the first is epithelial ovarian cancer, which accounts for about 90% of all ovarian cancer cases. And this is when the cancer arises in the thin layer of tissue that covers the outside of the ovary. There's also sex cord stromal tumors, which is when you get cancer in the hormone-producing cells or the connective tissue of the ovary. So typically these tumors form from the follicle cells, and it only accounts for about 7% of ovarian cancer cases. And then lastly, we have germ cell tumors, which is when you get cancer in the egg-producing cells of the ovary. But this is the least common type at only 3%. So the main reason why I decided to focus on just epithelial is because it occurs most often, and the symptoms between epithelial versus sex cord stromal and germ cell are very different. So I'm just focusing on epithelial today. And just to kind of show you guys what epithelial ovarian cancer actually looks like, we have a healthy set of female reproductive organs on the left and a cancerous set on the right. So on the left, as you can see, there are two ovaries, and they're both about the size of an almond, and they're nice and smooth. Whereas on the right, we have a drawing of cancerous ovaries, and there's massive overgrowth of the epithelium, and it's completely taking over the ovary. So it's no longer nice and smooth or small. It's definitely overgrown and very rough in texture. So just to kind of walk you through the progression of ovarian cancer, typically it starts as defined as stage 1 when you just have cancer in the ovaries. Stage 2 is when the cancer spreads throughout the pelvic region. Stage 3 when the cancer makes its way into the abdomen, and stage 4 when the cancer spreads to secondary regions of the body, so beyond the abdomen. Unfortunately, only about 15% of cases are diagnosed before metastasis outside of the pelvic region. So the majority of cases are diagnosed in stage 3. And this is why ovarian cancer is often called the silent killer. There's usually no symptoms prior to stage 3, which is why it's so difficult to diagnose before then. And this results in really high death rates. There's only about a 45% 5-year survival rate average for ovarian cancer. And as you can see by these numbers, your likelihood of surviving if diagnosed early is very high, but once you start seeing symptoms at stage 3, which is when it's most often diagnosed, your likelihood of survival beyond 5 years decreases greatly. So just to give you guys kind of an overview of how the rest of this presentation is going to go, I'm going to start talking about our patient, and I'm going to give you some background, her symptoms, why she decided to go to her GP in the first place, the diagnostic process that her gynecologist and oncologist went through, and then eventually the treatment she underwent and what her future prospects looked like. So I didn't have my textbook with me. I found this case study online from Prime Incorporated if anybody else is interested in using that for their online case studies. But this is the case study of AJ, ovarian cancer, and a young woman. And I'm going to bounce back and forth between talking about her case specifically and ovarian cancer in general. So first and foremost, the most common symptoms associated with ovarian cancer are bloating, pelvic or abdominal pain, trouble eating or feeling of fullness, feeling of urgent or frequent urination, fatigue, upset stomach, back pain, pain during sex, constipation, changes in menstruation, heavy or irregular bleeding, and weight loss. Now, the reason why AJ went to her gynecologist is because she was experiencing bloating, pelvic and abdominal pain, fatigue, back pain, and constipation. AJ is typically a very active young female. She's only 20 years old, and she was having so much abdominal pain that she was having trouble working out, which obviously raised concern to her, so she saw her gynecologist. Now, some of the risk factors that are associated with ovarian cancer include age, as the average age of onset is 63 years old, being overweight or obese, nulliparity, which means never having children, pregnancy after the age of 35, undergoing fertility treatments such as IVF or postmenopausal fertility treatments, and a family history of ovarian, breast, or colorectal cancer. So there are some factors that actually decrease your chance of developing ovarian cancer, and these include pregnancy, breastfeeding, the use of oral contraceptives, other methods of birth control such as tubal ligation and intrauterine devices, and a hysterectomy. So in AJ's case, she really doesn't fit into the profile of someone that would be likely to have ovarian cancer. She's very young, hasn't had any children yet, things like that. However, when her doctor was looking at her family history, he realized that her mother is a breast and ovarian cancer survivor. So that puts AJ at a very high risk for developing ovarian cancer. And just to kind of give you guys an overview of what we're looking at with our patient so far, AJ is a 20-year-old female. Her symptoms include bloating, abdominal pain, pelvic pain, fatigue, back pain, and constipation. She has a normal menstrual history, doesn't use birth control, and is very active, and her mother is a breast cancer and ovarian cancer survivor. So at this time, her gynecologist decided to undergo 3 parts of a physical examination. The first was a pelvic exam, which is a visual and physical inspection of the reproductive organs, which is very typical of any gynecology visit. So I'm going to focus in on the second 2 exams that he did. The first being a CA-125 blood test, and the second was a transvaginal ultrasound. So first with the CA-125 blood test, CA-125 means cancer antigen 125, and they find that levels of CA-125 tend to be elevated in ovarian cancer. So that tends to be the first blood test that they'll do. However, this blood test isn't alone enough to diagnose ovarian cancer, because CA-125 levels tend to be elevated in other diseases such as endometriosis and also during some stages of the menstrual cycle. So if we look at AJ's test results, we see that her CA levels are 109, and this is considered to be very high for a female. So we already know that she's at risk for something being wrong. And then next we have a transvaginal ultrasound. So using ultrasound technology, they're able to get high-resolution images of the internal reproductive organs, and it's basically a more detailed pelvic exam. So we're actually able to see the morphology of the ovary and any abscesses that are associated with it, rather than just feeling around for them. So in this ultrasound image, we have the left ovary, and it looks about a healthy size. However, there is a mass on the left side of the left ovary. So at this point, AJ's gynecologist was concerned, so he referred her to an oncologist because all the signs are pointing to ovarian cancer. So her oncologist decided to do a biopsy of the mass that was on her ovary. So this is done just by sticking a needle through the abdomen and taking a small tissue sample of the abscess. And then her gynecologist would send this sample to a pathologist and consult with them regarding what the diagnosis would be. So the pathologist made a slide of the tissue sample and saw that there was overgrowth in the epithelium. This picture on the right shows a slide of epithelial ovarian cancer, and this suggested to the pathologist that AJ was suffering from ovarian cancer. So some other common diagnostic tools that would typically be used to see whether or not the cancer had metastasized would include doing a pelvic lymph node or retroperitoneal lymph node dissection to see whether or not there was metastasis in the pelvis or the abdomen, and then doing a CT scan, MRI, or PET scan, or other types of x-rays to see if there was metastasis to other major organs. So on the left, we have the axillary lymph node dissection, which shows ovarian cancer. And then on the right, we have a CT scan with ovarian cancer metastasis to the liver. And in neither of these cases occurred in AJ. They didn't do any other metastatic diagnoses to see if the cancer had moved. However, it seemed that she was just in stage 1 and there was no metastasis beyond the ovary. So treatment for ovarian cancer, AJ's oncologist suggested a really aggressive approach of a bilateral salpingo oophorectomy. and a hysterectomy, which means a total removal of the ovaries, fallopian tubes, and the uterus. But other common treatments include an omentectomy, which is the removal of part of the abdomen lining, as well as chemotherapy and radiation therapy. So although it wasn't mentioned in the case study, it's very likely that AJ would also undergo chemotherapy or radiation treatment. And then moving forward, as soon as the ovaries and uterus are removed, this initiates immediate menopause and infertility in a female. Because AJ is so young, it's very likely that she would undergo hormone replacement therapy. As you can see in the graph below, the hormone levels change drastically in menopause. So in order to assuage those symptoms, it's very likely she'd be put on this treatment. And because the cancer was only found in one of her ovaries, it's also possible for them to undergo oocyte cryopreservation with the healthy ovary, which would be able to preserve her ability to have genetically related children, although she won't be able to carry them because she no longer has a uterus. And it's important to recognize that AJ is also at a very high risk for breast cancer. Because it is familial, it's likely that she either has the BRCA1 or BRCA2 mutation. So there's a very good chance that she could develop breast cancer later on, and she should probably undergo genetic screening to make sure she doesn't have these predispositions. And she should also consider a prophylactic mastectomy to prevent the development of breast cancer later on. It's really important to remember that AJ's case is very atypical for an ovarian cancer case. The average age of onset in epithelial ovarian cancer is in postmenopausal women at age 63, and it's typically diagnosed at stage 3 with only a 39% chance of survival. However, AJ is very young, premenopausal, and it was diagnosed so early that it's very likely that she'll be able to live a happy and healthy life. So thank you guys for listening to my presentation. If you guys have any questions, feel free to email me, and I hope you guys are doing well on this first week of online classes. Thanks, guys.